My name is Andrea Everett, and I am a person who identifies in long-term recovery. I'm a recovery coach and certified peer support specialist with Safe Communities in Dane County. What peer support means to me, or what role I play, is I meet people where they're at. I help people get resources, wraparound care. Um, I struggled with heroin and meth addiction for a great part of my teen and um, middle age, or 20s. Um, and when I found recovery, I was placed in this training for peer support. And I couldn't even imagine what I was unfolding in my career path. That training, learning that we can walk alongside people, that my lived experience could help another person in addiction find recovery. That's what got it for me.
My name is Lana Hamilton. I am a certified peer specialist, doula for Safe Communities in Madison, and I'm also the team lead for our addiction resource team in the community. I work for Safe Communities. I am also a person in long-term recovery. Peer support is just walking alongside someone that is either substance use disorder challenges or mental health challenges. I'm on the same power level as them. I'm not telling a person what to do. I'm asking them what they need, and that changes everything as far as a person moving their life into the positive direction. I struggled with substance use disorder, and I sought treatment for decades, and I could never succeed. I gave up hope. I was unemployable, and however, I was pursuing a career, and I had education to become a substance use disorder counselor. I wanted to be a trauma therapist, but I could never find a way out for myself. My life would always go back into destruction. So at the end, I was unemployable. So when I began my path again, I had friends from the recovery community, and the first friend offered me the recovery coach training. Would I be willing to? And that was amazing. And then after that was another friend offering me a job position, and then then was the Wisconsin Certified Peer Specialist training. And then after that, it kept unfolding as well. And I had training to become a doula. So to be able to use my lived experience, really, it means a lot to me, because it helps to change those experiences and put value to them. And also to know what it's like to just be hopeless and not think that there's ever going to be an end and ever going to be a different way to live. That connection that I have is just unparalleled, and it's got value to it now.
You know, when someone who is struggling with mental health or substance abuse walks into a doctor's office, they're already full of shame. So when a healthcare professional looks at us with those judgmental eyes, like we're drug seeking, even though we're just looking for our mental health prescription that we actually really need. Um, that's what gets me. You know, when I seek help and my history is looked at, and then I'm told I can't be on this medication because of my history, but then I'm told that I have this diagnosis. So then where do I fit in? Um,
I'm already feeling less than, and I'm feeling a lot of guilt and shame about my life. And it's like the healthcare professional, what their beliefs are, it's like I can feel them. I can feel the judgment without even a word being said. I can like feel it in the room. And I'm not contagious. Um, and it's not something that I wanted for my life. It's something that I have dealt with, and to know that it's a brain disease and that there is a way to treat it offers me hope. If I'm in front of someone that doesn't believe that there's going to be hope for me, then I I'm not going to have hope for myself either. Yeah, my first experience was having an abscess on my arm, and it was scary for me just to look at and not understand what it really was. And then to come in and seek help and treatment, I was told no, I cannot have pain meds because of my heroin addiction. And then I was held down by more than one person, holding my arm down while they cut into it. And it was horrible. They ended up treating it, and then, it was like, we got this done. Like, it was just such a dehumanizing feeling. And another time I came in after an overdose, and I was completely wet from people throwing water on me, and I was given like scrubs to put on. I didn't have any underclothes on, and the nurse, like, I could just see her face cringe, like, and the feeling that I was dirty, like, I, it would jump off on her, and that was really hurtful. I was a very clean person. I was just suffering from drug addiction.
had peers that needed to have they needed medical clearance for detox. And when my peers walk into an emergency room and need to be cleared, everybody's face gasps, or there's a long waiting. That's what we always hear. There's a long waiting time. I've sat with peers that have waited 4 hours to get medically cleared just so that they can go to detox. Um, I've listened to the questions and the eye roll that the doctor has when they're asking them why they're here. That should be a time that we're empowering them. This person is here in the emergency room waiting to get medically cleared so that they can go to detox. Like, that's the time that we should be empowering them. Um, listening to healthcare professionals tell us that we're here because of ourselves, because of a choice that we made. We already know that. We don't need to be told that again. We need help. We need an olive branch. We need services. We just need compassion, is what we need at that time. Watching my peers struggle, that type of experience is what stops them from wanting to even get medically cleared in the first place. So I've had multiple peers that, when we talk about going to detox, we talk about going to residential and what steps and processes we have to take. And when that comes up, it's always, I don't want to sit there for hours, or I don't want to deal with what the shame looks like or what the comments are said. So trying to empower my peer to go get medically cleared is insane. There should just be compassion. That's where they should feel hope during that time. And I think that when women are pregnant and are suffering from mental health or substance, I feel like they just need somebody by their bedside so that they can ask these hard questions. Like, we have questions that we need answers, but we are scared to ask, right? Mm-hmm. So we just need somebody to sit down by us, so we can ask these questions so that we understand what's going on. Most of the time, we don't even understand what's going on. Like, all these things are flying at us, and nobody's taking the time to explain to us, to ask us if this is okay. Um, when a mother has to sit in the NICU and visit her baby, that's not a time to judge that mother. That's a time to wrap around that mother, make sure she has support, make sure she has the resources that she needs so that her and baby can go home. I need a doctor that's going to ask me what's the plan, instead of asking me what my history is about and how my substance use came about. And I would just rather have somebody who wants to help me find services, or somebody that is looking at me as a whole person, behind the substance use. What is triggering that? What is the problem? Help me find that. That's what we need.
Yes, I need someone to believe in me, because I'm not believing that I'm going to make it. And when it changes everything, when someone believes in me and really truly believes that it's possible to change, we can, it's everything, whether we are going to make it or not. It can have a devastating effect on us. Yeah.
I need someone to be on my level. Sit down, talk to me, don't stand over me. Have care in your voice. Ask me what I want. Don't tell me what I need. That's what I need. And then when you ask me what I want, I need you to support that. I need help. I need compassion. I need to be treated like a human. If you can just have a common conversation with me, and just talk to me on the same playing field. And it's really about asking me what I want, not telling me what to do, not telling me what I need, not being judgmental and reminding me why I'm where I am. That's probably the biggest thing. Like, we know where we're at. This is our rock bottom. This is where we're looking for a hand.
We need someone to believe in us, because I know for me, my children were not in the system. They were with family members, but I believed that I was hurting my children, and because I couldn't stop, and I would try, and then I'd fail again, and I knew that was hurting them. But I really wish, if anything could have changed in my history, it would have been that I would have continued to try. I didn't believe I had anything to offer my children, and it was a lie. My children wanted me, and so their path, could have been different, even if I would have just been in their lives, period. I took myself, because of my guilt and shame, and I did not connect with my family for 8 years. That's a really long time to have my sisters miss me, my brother miss me, my mother miss me, and my children. So we just can't do it alone, and we need someone to believe in us until we can believe in ourselves. I think when the healthcare professionals understand what goes on in the brain, how our brains are different, things like that, and then I remember it made a huge difference in my life when I was told this information. It changes everything. So education is number one in what you believe in, because it will be felt, and that's just what I've experienced. Like what you're thinking is being communicated in some way.
Hmm.
We can recover, and no matter how far down we go, we still can recover because I've seen it and I've experienced in my own life as well. And so just treat others the way you would want to be treated.
I think that if doctors are working with people who use substances, they need self awareness, they need education, um, and just a little bit of patience and compassion. Um, if you want to work with, if you want to work in this field, you have to step outside of the box and really look at the whole situation, because when someone comes in with substance or mental health, there's usually more behind it. So I just would like doctors to have more education, more self-awareness, compassion, think about their morals, and remember that we are human and that we do recover.